Diabetes is a non-communicable disease that causes significant morbidity and mortality. Number of patients with diabetes in Thailand is increasing continuously. Treatment of diabetes requires a lot of patient motivation in self-care and healthy behavior.
Siriraj Diabetic Center emphasizes on diabetes self-management education and provide the patient with the essential skill in handling their food, medication, insulin, and self-glucose monitoring.
จากที่ได้รับความรู้จากศูนย์เบาหวานแล้วเนี่ยก็พบว่าเราสามารถทานอาหารที่ถูกต้องเหมาะสมนะครับการควบคุมน้ำตาลก็ดีขึ้นนะครับทำให้เรามีความสุขกับชีวิตมากขึ้นครับ
ได้รับคำแนะนำจากคุณพยาบาลนะคะวิธีปฏิบัติตัววิธีออกกำลังกายวิธีกินอาหารเปลี่ยนพฤติกรรมใหม่สุขภาพดีค่ะแข็งแรงเหมือนกับไม่เคยเป็นเบาหวานเลย
We also provide one-stop diabetic complication screening, including diabetic retinopathy, diabetic food problems for early detection and appropriate treatment. We hope that the learning process occur in our center help people with diabetes to balance their life and live happily. Live a happy life despite having diabetes.
Thailand provides universal health coverage, including free ambulance transport. But why do most people travel to the hospital themselves? And why do people think ambulances are too slow?
บางพื้นที่เป็นซอยแคบบางทีผมยังต้องพารถพยาบาลเข้าไปหาผู้ป่วยเลย
ทีมรถพยาบาลยังมีน้อยกับความต้องการของประชาชนครับ
So, what is the solution to this problem?
A straightforward answer would be not enough ambulance, just add more.
Is it just that simple?
Well, not really, because the real problem is we lack a system that provides the patient's accurate location. This problem can easily be solved by cooperation between the community and Siriraj EMS Center.
This is why Siriraj EMS Center has initiated many projects to involve the community in emergency care, starting from teaching basic CPR and the use of emergency medical services, extending to developing CPR volunteers within the community itself. Other than enhancing knowledge in the community, the center has also created an application that will locate the patients directly called Siriraj Emergency Responder App under the concept.
The best mobile application for widely access to the patient is not using any mobile application.
This application will send a message to the caller's telephone, and all they have to do is press the message. The phone will automatically send an exact location to the ambulance. You see, the caller doesn't need to install any application. Once the ambulance arrives, they give patient treatment, and if needed, a doctor is available for consulting 24 hours through the center's telemedicine system, so you're sure that the patient gets the highest quality of care. Since opening the center in 2018, patients with cardiac arrest have received more bystander CPR than ever before, and access to emergency medical services have increased significantly, showing that the center's projects have truly made an impact to the community. Though the center may be starting small, giving care in the communities that are close by, they hope that their initiative and projects will set a standard in EMS patient care all around the country, so that whenever you call 1669, you are getting the highest quality of care you can receive.
Mrs. Po Buatong had a strong desire to have children. She has tried countless times, and this may be the last one.
หมอขอแสดงความยินดีด้วยนะครับคุณแม่ได้ลูกแฝดนะครับ
จริงเหรอคะคุณหมอ
คุณยานีครับคุณยานีนี่หมอไหมครับ
ค่ะ
คือบังเอิญว่าหมอตรวจเจอความผิดปกติบางอย่างนะครับ
เป็นเวลาผ่านมา10 กว่าปีแล้วครับที่เราได้ดูแลคุณยานีตอนนั้นคุณยานีเนี่ยมีความเป็นไปได้ว่าอาจจะมีการถ่ายเลือดซึ่งกันและกัน แล้วก็เป็นภาวะที่เป็นความเสี่ยงที่รุนแรงได้ในสิ่งที่เราจะตรวจเจอในคันแฝดนะครับ
สุดท้ายเนี่ยก็เกิดการไปตรวจเป็น second opinion ที่โรงพยาบาลศิริราชโดยทางทีมของอาจารย์ตวงศิษย์ก็พบว่าน้องเป็นโรคนั้นจริงๆ
Twin transfusion syndrome is a serious complications of monoclonic twins. It occurs in about 15% of monoclonic twin pregnancies. The physiology of twin transfusion syndrome is from imbalance of inter-twin blood transfusion. Without treatment, the miscarriage rate is approximately 100%.
Currently, the best treatment is fetoscopic laser coagulation.of placental anastomosis, leading to neonatal survival rate of 80%. As this is our first case, multidisciplinary team consultation was arranged. With the dignity of King Father, at the end, we will succeed.
มันเกิดเป็นรายแรกในเมืองไทยอะค่ะเพราะฉะนั้นมันดูมีความเสี่ยงมากแต่เราก็เชื่อว่าด้วยอนุภาพของอะไรก็แล้วแต่เราอยู่ถูกที่ถูกทางเราอยู่ในโรงพยาบาลที่ดีที่สุดคุณหมอที่เก่งที่สุดเพราะฉะนั้นเราก็มั่นใจอะค่ะว่าจะได้รับการรักษาอย่างดีแล้วก็ความที่เราไม่แน่ใจว่าจริงๆเราไม่แน่ใจว่าจะประสบความสำเร็จไหมแต่รู้สึกเชื่อใจคุณหมอแล้วก็ทีมงานที่ดูแลเราทุกท่านค่ะเราก็ดีใจค่ะที่ทุกวันนี้มีส่วนร่วมในการที่ช่วยให้คุณแม่ที่ตั้งครรภ์ที่เกิดปัญหาเนี่ยสามารถมีสถานพยาบาลที่ดูแลได้ตลอดจนกระทั่งคลอดออกมาค่ะ
Division of Maternal Fetal Medicine, Department of Obstetric and Gynecology, in collaboration with Faculty of Medicine Siriraj Hospital, has established a Siriraj Fetal Therapy Center aiming at collecting and organizing the knowledge of fetal therapy in Thailand. We aim to distribute, train, and also serve domestic patients as well as international patients more effectively.
The name SIE Lead was the mnemonic core value of our Center of Excellence, standing for excellence, longevity, innovation, technology, and education.
The first E refers to excellence, which means excellence in service, research, and academic part. We focus on enhancing our performance to become superior level in all aspects, improve our service from national qualification to international qualification standard.
The L is referred to longevity. Result of our replacement surgery case, there will be no more belief that the patient will need to revise in 10 or 20 years after the surgery. In fact, we aim to operate on the patient as the best performance that we can do, leading to our patient's final long prosthesis without any further revision surgery.
The I stands for innovation. We are currently inventing our prosthesis with the same quality and standard as the international level. We developed the minimal invasive surgery technique to help our patient promote early recovery as one-day surgery. We also focus the rehabilitation program to help our patient return to do floor activity with safety.
The T refers to the term technologies. Our SI Elite Center is becoming the leader in using the advanced update technologies in joint replacement surgery. Nowadays, we already have the robotic arm assist surgery using our patient in hip and knee replacement surgery. These proven technologies could increase the precision and accuracy to less than 1 degree or 1 millimeters.
The last E refers to education. One of our main missions to up-level education aims to reform community wellness and advance orthopedic adult reconstructive surgery care at the national and international level.
From all the states above, clear evidence is that we are the high standard center of the excellent, high-performance multidisciplinary team in taking care of the hip and knee osteoarthritic patient with good sustainability. Thank you for your attention.
In the past 30 years, there were numerous referrals of sick newborns and children with inherited metabolic disorders to Department of Pediatrics, Siriraj Hospital, for diagnosis and treatment, with clinical presentation of delayed development, mental retardation, intractable seizures, and comatose conditions. Delayed diagnosis usually results in severe brain damage, severe mental retardation, and even deaths. We successfully established Center for Diagnosis and Treatment for Inherited Metabolic Disorders in 2001. In 1991, another important newborn screening program was also developed to prevent mental retardation in newborn babies. Initially screened only 2 conditions: congenital hypothyroidism and phenylketonuria. However, in 2014, we were able to introduce new technology, tandem mass spectrometry, and screen 40 disorders, one and only such center in Thailand.
For expanded newborn screening, we started the pilot project with support from the National Health Security Office, Bangkok region, to screen 200,000 babies born at 17 hospitals in Bangkok area. This project prevented many children from death and disability, and it will become a national program in the near future. Recently, treatment of small molecule type of inherited metabolic disorders has been covered by the Universal Coverage Project of Rare Diseases by Thai government. Our center can provide a unique one-stop service care, including expanded newborn screening, laboratory diagnostic tests, comprehensive treatment, and genetic counseling for children and families with inherited metabolic disorders.
Siriraj Center of Excellence for Inherited Metabolic Disease and Newborn Screening has served babies and children well all across the country, and most recently received Excellent Service Award from Thai government in 2019.
Interventional radiology is a medical field of minimally invasive treatments for diseases of nearly every organ system. The procedure is performed using image guidance to navigate small thin tubes or catheters along with tiny instruments which are inserted into the body to the targeted area. The access route can be via vascular channels or direct percutaneous puncture into the lesions. These interventional radiology procedures are very valuable not only in a less invasive sense, but in terms of less pain, small incision, and faster recovery time in comparison to traditional open surgery. The examples of our treatment for vascular diseases of central nervous systems are removing blood clots from the brain in acute ischemic stroke, inserting platinum coils into the aneurysmal sac, dilating or stenting stenotic vessels, and injecting embolic materials into the abnormal vessels in order to prevent or stop intracranial bleeding. For cancers, we play an important role in liver cancer treatments. The early stage can be cured by tumor ablation, while the more advanced stages can be treated by transarterial chemoembolization. Moreover, vascular injuries at the neck, chest, abdomen, and extremities can be accessed immediately as the most effective tool for minimizing blood loss.
Interventional radiology was first established at Siriraj Hospital since 1997 and became Siriraj Center of Interventional Radiology or SiCOE in 2017. With continuous improvement on modern technology and high standard level of care in expanding service to become more accessible to all patients, providing knowledge and education, building a referral pathway, and producing high-quality interventional radiology professionals. In order to achieve our goal, SiCOE will make interventional radiology more accessible.
Intervention for life.
Vital change for the novel life.
Siriraj Liver Transplant Center, Faculty of Medicine, Siriraj Hospital, has been performing liver transplants since 2002 with a multidisciplinary team of surgeons, anesthesiologists, transplant pharmacists, perioperative nurses, transplant coordinators, and also other supporting teams.
Over 20 years, more than 350 cases have received treatment from our liver transplant center. We are committed to elevate integrated medical services to international standards. We implement comprehensive patient care system starting with examining process, preoperative preparation, meticulous surgical technique, exceptional intraoperative care, and post-operative monitoring, providing fast and accurate procedure.
With specialization and consistent development of multidisciplinary team working in unison to establish the whole process of medical care. An exceptional service blueprint.
All in the sincere hope that liver transplant patients are able to return to a healthy living. We aim to become a model and a mentor for new liver transplant institutes in many parts of the country.
Liver transplant would be a major transformation of a patient's life. It goes beyond extending one's life to renewing life for patients and their families.
All of us at Siriraj Liver Transplant Center
adhere to holistic care and integration of knowledge.
over 20 years of experience
has created initial model of treatment for you and your family to offer you
healthy and long life.
Come with us, Siriraj Liver Transplant Center.
Siriraj Liver Transplant Center, Faculty of Medicine, Siriraj Hospital. Vital change for the novel life.
Can you walk or run? What happens if one day you found out that you can't walk or run anymore? Look at these children. They were running and walking fluently, but one day they will lose control of their body muscles. Neuromuscular disease is a group of diseases that cause patients to gradually losing their muscle control, resulting in full loss of maneuverability. Did you know over than 12,000 newborn children are diagnosed to be neuromuscular diseases per year? Previously, these patients are required to visit doctors 7 to 8 times annually, costing them over 100,000 baht per year and resulting in grave inconvenience for their daily life. To reduce these burdens on still receiving effective care, SINMD builds upon the one-stop service model and finally developed into Siriraj Center for Neuromuscular Disease in 2013. By visiting the center, patients will encounter a full suite of multidisciplinary care, including pediatric neurologist, rehabilitation physician, Thai traditional medicine physician, physical therapist, prosthetist, and nutritionist. Moreover, special education teachers and musical therapists are ready for patients who need more help. Last but not least, in order to attain exclusive diagnosis and medication, we cooperate with the Department of Orthopedic, Department of Biochemistry, Department of Pathology, and Division of Medical Genetics. Moreover, private agencies, NGOs, public sectors, and family associations are standby to alleviate and take care of these patients. Our annual gatherings of partner hospitals has strengthened our tie between medical professions and patients.
The Neuromuscular Disease Center should be a healthcare reference for neuromuscular disease and allow every patient to be able to access to this care to improve their quality of life.
The Siriraj Skin Laser Center is part of the Department of Dermatology Siriraj Hospital, Mahidol University. Here, our expert medical team uses the most advanced technology to provide the best care to our patients.
The vision of Siriraj Skin Laser Center is to be an internationally renowned skin laser center, and our mission is to provide a high-quality education, research, and service to effectively address all the needs of our patients and trainees.
We provide consultation and treatment for our patients using various modalities such as laser treatment for acne scars, birthmarks, and pigmented lesions, tattoo and hair removal, botulinum toxin injections for wrinkles and facial rebalancing, soft tissue fillers augmentation, skin tightening and body contouring, as well as sclerotherapy for leg veins. Our patients are cared for by our entire professional team. We use the latest state-of-art technology. For more than 10 years, we've been providing academic training through our fellowship program on laser and dermatologic surgery, as well as through our short course training in skin laser surgery for both Thai and international doctors.
Choosing to go here for my fellowship training has one of the rewarding experiences and choices I have made in my life. Training here is such a good experience. I wouldn't trade it for anything else in the world. Not only do we get to learn with our consultants who are experts in their respective fields, but we're also at the forefront where many publications have been released that are world-renowned.
Each year, we undertake numerous research projects, many of which have been published in leading international academic journals, taking photos before each session and on subsequent follow-ups to ensure the best treatment outcomes for our patients.
The Siriraj Stroke Center was established in July 2015. Its visions are to provide world-class stroke care and to create the changes towards healthy lifestyle for all.
In 2015, we spent 42 minutes on the door-to-needle time. The following year, the time was significantly reduced to 30 minutes, and in 2020, the time was further reduced to 23 minutes. Siriraj Mobile Stroke Unit Project. This project was launched on May 18, 2018. The mobile stroke unit is equipped with a portable CT scanning machine, teleconsultation device and various medical equipment as well as stroke medicine. It is operated 24/7 by a team consisting of physicians, nurses, and CT technicians. The project was initiated with the goal of bringing hospital services to patients. The catchment area consists of Western Bangkok and Nonthaburi. Presently, we are expanding our services to provincial hospitals, which are new treatment paradigms for the country. The center is further pushed under collaborations between Siriraj and local provincial hospitals. By August this year, MSU services will be available in Ratchaburi, Chonburi, and Surat Thani. Siriraj Comprehensive Stroke Unit Project. Currently, the Siriraj Comprehensive Stroke Unit has been initiated and operated under various multidisciplinary collaborations and with recent technologies, including a 7 Tesla magnetic resonance imaging CT scanner, and 20 beds with a 15 bed for critical patients and 5 beds for semi-critical patients. The unit can now accommodate acute stroke patients from both arterial stenosis and arterial ruptures. In the same area, a Siriraj Stroke Learning Center will be in service in early 2022 with an aim to provide education and awareness to patients and their family members. Siriraj Stroke Center will continue to develop and focus on elevating stroke treatment throughout the country. We will continue to engage partnerships among governments, private corporations, and the people to develop the national healthcare model which can improve everyone's quality of life.
Siriraj Thalassemia Center is an excellent center for the care of patients and family with thalassemia. We was established in 2009 with the renovation of this historic building. The name Anantaraj derived from the King Rama VIII. This building has been the forefront of thalassemia research and care for the longest time. We have 3 important missions. The first is the service. The laboratory located on the 2nd floor of this building has remained the country's reference for the detection of carrier, the finding of new knowledges regarding thalassemia syndrome in Thailand, and the knowledge derived from this laboratory applied to the prevention and control program of thalassemia countrywide. The second mission is the research. The 3rd floor of this building locates the state-of-the-art research that dealt with the molecular basis of thalassemia, both in carrier and disease form. And those knowledges published worldwide by Professor Viprakasit and the team epitomize the advance of thalassemia care for the better quality of life. The 3rd mission is education. This center has the purpose of educate all various medical personnel in order to deal with prevention and control program as well as treatment aspect of thalassemia families. People with thalassemia can be dependent on blood transfusion, and those require sophisticated knowledge of how to deal with symptom management and medication program management. This center held year-long educational program for doctors and nurses alike in order to increase their knowledges for the sake of the care of thalassemia patients in Thailand.
At Siriraj Thalassemia Center, research is also a very important aspect. We are doing many dozens of the research on thalassemia every year. We divide into 3 different aspects of the research at our center. First is the basic science research related to thalassemia in order to understand pathophysiology of this disease much better, and that led us to discover a new hemolytic disorder in man back in 2014. The second part related to the clinical research. We perform and collaborate with several pharmaceutical companies in order to identify a new treatment modality for thalassemia patients. More recently, our work has been published in New England Journal of Medicine. The third part is related to the health services research in order to improve our care for thalassemia patients from diagnosis to management and prevention and control. Based on all this research, we have received the Sultan bin Khalifa Award for the best thalassemia center in the world back in 2013.
Our Dean of Faculty of Medicine, Siriraj Hospital, has the policy to include several cardiology subspecialties such as adult interventional cardiologists, cardiovascular thoracic surgeon, pediatric and congenital heart specialists, to establish a new treatment pathway in a heart center called Siriraj Transcatheter Heart Interventional and Surgery. This is to treat all 4 heart valves with catheter-based method instead of open heart surgery. It is to reduce a hospitalization day from 7 days to 2 days and also reducing several surgical complications.
The highlight of Siriraj Hospital is Siriraj Heart Team, which is collaboration between cardiologists, cardiothoracic surgeon, and heart surgeon. We will help for risk assessment before the first year to plan for the best treatment option for each patient to ensure the safety of our patient as much as possible. Siriraj Heart Teams commit to provide patients the best treatment and care to best.
It is my honor to be a part of Siriraj Heart. It is my honor to be a part of Siriraj Heart Team. This is not a one-man show. We have team players who have expertise in many areas, including intervention, surgery, and advanced medicine. If you have a problem, you'll sit down and have a discussion like a family. You'll come up with the idea that is the best for the patient. Having this center of excellence, you will give patients to more services. More patients will get an appropriate treatment, and they will go to the same pathway no matter who they are.
Thanks to the Dean and the Administrator of Faculty of Medicine, Siriraj Hospital, who foresee the importance and approve to establish this Center of Excellence of Scientists by providing the budget, giving support to develop the better treatment. In addition, there is also cooperation with foreign countries in order to develop a better academic or research work. This center will be able to motivate the treatment or academic research for patients in this group to be beneficial to patients in the future.
Urticaria is a common skin condition that can affect patients' well-being and quality of life. Siriraj Urticaria Clinic has been established at the Department of Dermatology, Siriraj Hospital since the year 2001 to provide the proper diagnostic and therapeutic approaches by multidisciplinary team to enhance better treatment outcome for patients with urticaria. Our team has published many articles in high-quality journals, and our staff has been invited as a delegate in the development of the current European Academy of Allergy and Clinical Immunology and World Allergy Organization guideline for urticaria. This is a global guideline which takes into account the recent progress and outline the evidence-based diagnostic and therapeutic approaches for urticaria. In the year 2018, our center has been certified internationally as the Urticaria Center of Reference and Excellence, or UCARE, by the Global Allergy and Asthma European Network of GALEN. GALEN is a network of excellence of the leading European clinical and research facilities in the field of allergy. Siriraj Urticaria Center is the first and the only one UCARE in Southeast Asia.
ภาวะขาขาดเลือดเรื้อรังหรือหลอดเลือดส่วนปลายอุดตันเป็นสาเหตุสำคัญที่ทำให้ผู้ป่วยสูญเสียขาซึ่งผู้ป่วยส่วนมากมักมาด้วยอาการปวดหรือแผลที่บริเวณปลายเท้าหรือหากมาช้าอาจส่งผลให้เกิดแผลลุกลามขนาดใหญ่และอาจสูญเสียขาได้ในที่สุด
ศูนย์หลอดเลือดศิริราชถือกำเนิดโดยการนำของศาสตราจารย์นายแพทย์ประมุขวุฒิรางกูลและกับผมรองศาสตราจารย์นายแพทย์เฉลียงเรื่องเศรษฐกิจโดยมีแนวคิดในการจัดตั้งทีมเฉพาะทางในการดูแลผู้ป่วยโรคหลอดเลือดส่วนปลาย
ทีมเรามีความพร้อมในการให้การดูแลรักษาโรคหลอดเลือดแดงแบบเป็นองค์รวมโดยมีผู้ป่วยเป็นศูนย์กลางทั้งนี้ได้มีการนำเทคโนโลยีที่ทันสมัยและเหมาะสมมาใช้เพื่อลดอัตราการเสียชีวิตและความพิการของผู้ป่วยสมดั่งคำขวัญของศูนย์ที่ว่าเก็บขารักษาชีวิต
ศูนย์หลอดเลือดศิริราชเป็นศูนย์ที่ให้บริการผู้ป่วยภาวะขาขาดเลือดเรื้อรังที่มีความพร้อมในการให้บริการกับผู้ป่วยทุกๆด้านไม่ว่าจะเป็นด้านการวินิจฉัยโดยแพทย์ผู้เชี่ยวชาญอุปกรณ์ทางการแพทย์ที่มีมาตรฐานและทันสมัยการเตรียมความพร้อมก่อนการผ่าตัดและการดูแลสุขภาพโดยรวมของผู้ป่วยโดยทีมแพทย์และพยาบาลเฉพาะด้านนอกจากนี้ยังมีการจัดประชุมแพทย์สหสาขาเพื่อร่วมให้การดูแลสุขภาพของผู้ป่วยโดยรวมได้เป็นอย่างดีรวมถึงการบริการที่หอผู้ป่วยโดยมีทีมแพทย์และทีมพยาบาลที่มีความเชี่ยวชาญมากด้วยประสบการณ์คอยให้การดูแลผู้ป่วยอย่างใกล้ชิดไปจนถึงการใส่อุปกรณ์ขาเทียมและการฝึกเดินศูนย์หลอดเลือดศิริราชยังมุ่งเน้นในเรื่องการสอนการวิจัยและการพัฒนาให้ศูนย์มีมาตรฐานเทียบเท่าระดับสากลศูนย์หลอดเลือดศิริราชเราภาคภูมิใจที่ได้เป็นส่วนหนึ่งในการดูแลรักษาผู้ป่วยทำให้เราได้มุ่งมั่นพัฒนาระบบการดูแลและศึกษาค้นคว้าพัฒนาผลงานวิจัยเพื่อให้ได้ผลลัพธ์ในการรักษาผู้ป่วยอย่างดีที่สุด
คุณหมอไม่ได้นัดแล้วนะคะเสียใจด้วยนะคะแต่เราไม่มีการรักษาเพิ่มเติมเพราะว่าคุณหมอรักษาจนสิ้นสุดวิธีการรักษาแล้วนะคะ
Decades ago, Thailand's eye care services emphasized medical and surgical treatments. No further medical help was provided to people with incurable eye conditions. If the visual disability occurred at an early age, it would delay children's global development and jeopardize their future. 1.3 billion people in the world have a visual impairment. 260 million of them became visually disabled because of incurable eye conditions. Most of the visually disabled live in developing countries, with 2 million in Thailand. In 2002, Siriraj Hospital established a vision rehabilitation service. Working in partnership with other departments and outside organizations, the Department of Ophthalmology took the initiative to develop a model named holistic care through vision rehabilitation services for the visually disabled. Following a permanent visual loss, patients are given mental support as a priority. A rehabilitation plan is then developed with them. They receive a free of charge one-stop service tailored to their needs. It includes the provision of visual aids, training in daily living activities and mobility skills, and the coordination of occupational and spatial school programs. For children, developmental stimulation is also provided to correct for their global developmental delay. We've found that after receiving the services, the visually disabled have significantly less difficulty performing activities and have significant improvements in their quality of life compared to the past. Giving the opportunity to access appropriate medical help promotes justice and equity for the visually disabled. It also makes the communities and the world better for all.